I'm going to talk a little bit about incontinence in men now. Male stress incontinence, and when I say stress incontinence, and females have this much more than men do. About 80% of the patients that have stress incontinence are females, about 20% are men. But for men who have had prostate surgery, sometimes there can be incontinence short term, sometimes a little bit longer term, but usually it's a matter of months that incontinence can happen. And there's something called a collagen injection, and it's kind of like a plumping up thing. It's kind of like a Botox, where collagen can be injected to the urethra in the area where the muscles have been weakened, pelvic floor muscles, and it can actually help to reposition the urethra and develop new tone in the sphincters that can then allow for the man to recover complete urinary control. Collagen injections. Collagen injections can also be used with females. A sling procedure works both for men and for women with stress incontinence. About 70% who have a sling procedure, both male and female, have a positive outcome. When I talk about stress incontinence, it's the laughing, the coughing, the lifting, the exercising, and all of a sudden there's involuntary leakage. That's stress incontinence. Male overactive bladder, it's one and the same as what we call urge incontinence. Those are the same thing. Often caused by an enlarged prostate gland. And I think I mentioned earlier that after age 40, in some men, the prostate gland, just through the normal process of aging, starts to just slowly grow. It's not a cancer, it's just an overgrowth of the prostate gland. For overactive bladder in men, 60 to 70% of the time, opening up the prostate improves symptoms. And when I talk about opening up the prostate, there's a couple of different things. One's called a transurethral resection, or a TURP, and the other is a transurethral vaporization of the prostate, or a TUVP. Those are surgical procedures that can be done. And by opening up the prostate, or removing some of that overgrown material, because the urethra runs right down through the middle of the prostate gland, when it starts to expand and compress on the urethra, it has an effect on a man being able to initiate a stream, empty his bladder properly, get up many times overnight trying to go to the bathroom and not being able to. That's BPH, or benign prostatic hypertrophy. 30% of the time, if medications don't work with the TURP or the TUVP, then there's certain medications then that can help, and that grouping of medications is called the anticholinergics, which are widely used in female incontinence as well. Male incontinence treatments, the very simplest of which is simply bladder training, limiting fluids and planning regular trips to the bathroom, and this is someone working with the patient and developing a schedule for this type of thing. Kegel's exercises. The pelvic floor muscles can get weak, and through isolating those muscles in the pelvic floor and exercising them, sometimes using a process called biofeedback, we can re-strengthen those muscles and can regain control. Medications. Medications for male incontinence do one of two things. They either open the channel or they shrink the prostate gland. One type of medication is called alpha blockers, and what they do then is they remove relax the smooth muscle, allowing normal urine flow and preventing abnormal contractions of the bladder. Some of these, that you've probably heard of some of these anyway, they're advertised on TV as well. Hytrin, Cardura, Flomax you hear about a lot, and Uroxetrol. Another type of medication for male incontinence is Proscar and Avodart, and what this does then is it works to shrink an enlarged prostate. As opposed to opening the channel, this tries to shrink the prostate gland. Tofranol relaxes muscle and blocks nerve signals, which may cause bladder spasms and causing some urinary incontinence. And then antispasmodics relax the bladder muscle and relieve spasms. So that's some male incontinence treatments. How do we stay healthy? Heart disease. Avoid smoking or tobacco products and avoid secondhand smoke. this is not rocket science what I'm telling you right here. I'm sure you all know this. Include lots of fruits and vegetables. As I already said, typically 5 to 9 servings a day is what's recommended. High in vitamins, minerals, and fiber, low in calories in your diet, and avoid high-fat foods within the realm of a balanced diet. It all sounds really easy when you read it on the board. I know it's a lot harder to do that. Maintain a healthy weight. Get at least 30 minutes of exercise per day or as many days of the week as you possibly can. And to get the type of exercise that's the most beneficial, it would be something where you increase the heart rate. Get your heart rate up at least a little bit. And if you can't do that, do whatever you can. Anything you can do is better than doing nothing. But exercise is really important. Blood pressure checks regularly. If diabetic, keep blood sugar under control. Get your cholesterol checked on a routine basis. Decide that when your doctor, when that should be. If some physicians feel like a low dose of aspirin, like the 81 milligram aspirin, is something that's beneficial, but that would be something you would want to have your physician tell you to do first. And then know the symptoms of heart attack and stroke in case something would happen. And I'm just briefly going to run over those. I know that you probably know what they are, but heart attack symptoms: chest pressure, squeezing, fullness, or pain of the chest, discomfort in one or both arms, or the back, neck, jaw, or stomach, shortness of breath, nausea, sweat, and lightheadedness. Those are all symptoms of heart attack. We like to deny sometimes when we're feeling some of those symptoms and say, oh, it's just something I ate or whatever. But be real careful with that. If whenever in doubt, get checked out. It's a lot easier to find it in advance and get it fixed than it is to have a heart attack and have heart damage for the rest of your life. So now, stroke symptoms: sudden numbness or weakness of the face, arm, or leg, especially on one side of the body; sudden confusion, trouble speaking or understanding; sudden trouble seeing in one or both eyes; sudden trouble walking; dizziness, loss of balance or coordination; or a sudden severe headache with no known cause. Those are symptoms of stroke. Both really important to not deny them, and secondly, to get after it quickly so treatment can be established quickly. Cancer. How to stay healthy relative to cancer. Avoid smoking or tobacco products. That could be at the top of every list. Again, the diet with lots of fruits and vegetables and the exercise. Limit your exposure to the sun and use sunscreen. Drink alcohol in moderation or not at all. Be aware of carcinogens, and these are cancer-causing substances both at home and at work. Reduce your exposure to these. Have regular health screenings, and know your family medical history and review it with your physician. And sometimes we have multiple physicians, and the class that Lynn was talking about earlier at the beginning, which I'm going to mention a little later, living healthy, living active, living healthy, or chronic disease. That's one of the things we encourage the participants of the class who might be dealing with 4 or 5 different physicians. Be sure they all know everything about your health history so that they can then integrate your care the best. How to stay healthy relative to sun exposure. UV rays are the most hazardous through the middle part of the day, between 9 and 3, any season, any temperature. Most hazardous late spring, early summer, about where we are right now. Do you realize that yesterday was the longest day of the year? I hate that the days are going to start getting shorter. Causes premature aging and undesirable change in skin and skin texture. May cause melanoma, which is skin cancer, or cataracts. There's 160,000 new cases each year of malignant melanoma, which is the very deadly type of melanoma. 48,000 related deaths each year accounts for 75% of all skin cancer related deaths, and that's malignant melanoma. Wear protective clothing and hats. Use sun and lip screen of at least SPF 15. And wear wraparound glasses with 100% UV protection. Now, SPF, you probably all know what this means, but SPF stands for sun protective factor. And SPF is how many times longer a person can be in the sun when they're using that particular product. For an example, if you burn in 1 hour and you used an SPF 10, you could be in the sun for up to 10 hours. That's what that means. Recommendations for sunscreen: apply 30 minutes before going outside, apply liberally on all exposed skin, reapply every 2 hours or more often if you're sweating at all and possibly washing it off, and obviously reapply sunscreen if you've been swimming or something of that nature. General health tips: balanced diet. Dietitians say that the breakfast is the most important meal of the day. Dietitians tell me the breakfast should be the big meal, lunch should be the second largest, and your smallest meal of the day should be your evening meal. And it should be eaten at an early enough hour that it's not so close to bed. Ideally, we're talking about here. 5 to 9 servings of fruits, vegetables. Reduce saturated fat in your diets. Read food labels to help choose the most healthy foods. And watch how much we eat. Lots can be gained just by eating smaller portions. I know I have a tendency to increase my portions and I have to pull myself back. Exercise. More than 50% of Americans don't get enough exercise. At least 30 minutes of moderate exercise, preferably every day, which we've already mentioned. It doesn't take a lot of time or money or effort, but it really just takes some commitment and some discipline to get it done. Maybe it works better for a certain person in the morning, maybe a certain person at night. There are some people we talk to in our chronic disease class where maybe they can do 10 minutes now and 10 minutes 3 hours from now and 10 minutes 2 hours later. Whatever works to get some exercise built into our life. And whatever's fun, walking, running, gardening, cutting the grass, swimming, whatever it is that we enjoy, just so we get some exercise. Smoke-free. Tobacco products obviously cause cancer and lung disease. Smoking triples the risk of dying from heart disease. Avoid breathing in secondhand smoke. That's really been helped a lot since they took this smoking out of our restaurants and that type of thing. And utilize helplines, counseling, medications, patches, etc. to quit smoking. Now I'm going to run through these kind of quickly, but this just gives you an idea on routine exams. Number 1, be sure we retain a family doctor. I've already mentioned that. Screening exams are based on age, health history, and lifestyle. For example, screening colonoscopy for most begins at age 50. Routine exams find problems early and prevent problems and save lives. Now for men in the 18 to 39, you can see what's recommended every 2 or 3 years: blood pressure check, weight, exams of the skin, and testicular exams. Every 5 years, cholesterol. After age 35, in some cases more often than that, blood sugar. The thing is to get connected. Again, I'm being repetitive with your doctor, and there might be a special schedule that works better for you. It's not like one schedule is perfect for every person, but to have a doctor and to have that schedule. 40 to 49 annually, weight, blood pressure exams for skin cancer. If risk factors for cancer, possible screening of the prostate and colon in this age range here. Every 3 to 5 years, cholesterol and blood pressure check. 50 to 65 annually, weight, blood pressure, skin cancer, prostate exam. Starts at the PSA, I should say. The prostate exam starts much earlier as you go through life, but the PSA blood test at age 50, unless there's that family history. Fecal occult blood test, and every 1 to 3 years, blood count, cholesterol, blood sugar. Be tested for glaucoma, and then every 5 to 10 years, you start at age 50 with the colonoscopy, unless there's a family history, and then dependent upon what they find, usually it's every 5 to 10 years after that, depending upon your specific situation. Over 65, weight, blood pressure, skin cancer, prostate, a lot of the same things. General health tips: manage stress. Stress poses a real threat to our health and to our families and our employers. Life is very stressful, and whatever we can do to help to to decrease that stress. If it's sit down and read a book at night, or whether it's exercise or riding a bicycle or whatever it is that can decrease stress, we should try to do it. Protect mental and physical stress by engaging in activities that decrease stress both at home and at work. Very easy to say or to read off the board, harder to actually put into play. Physical activity, great for reducing stress. Exercise is a great stress buster. Many companies also offer counseling through an EAP service as required or is as necessary for a particular person, is Employee Assistance Program, which we have here at Mercy. Prolonged high stress is very unhealthy for our mind and body. Listen to our body. Let your body tell you when something is wrong. Pay attention and make adjustments. Try not to ignore. I know some people who I do certain things with physical activity, and they might get injured, but they don't want to just let their body's telling them, please let me rest. And they're saying, no, I need to go out for a run tonight. I'm going to do this and I'll just work through it. But our body talks to us and it gives us indicators of when it needs some adjustments or when it needs rest. And the best thing we can do, even though we don't want to, is listen to our body. Know your potential hereditary possibilities. This is related to cancer and heart disease, etc. Know if you've got several family members that have had heart disease or cancer, and know that for yourself and share that information with your physician. Your body may be at increased risk because of the type of work we do or how we play. Example like carpal tunnel syndrome can be a problem for people who sit at a desk all day and work on a computer. And we need to understand that that is a potential risk. Be sure we are ergonomically set up so that we have the least possibility of getting a carpal tunnel. Knee issues for athletes, etc., etc. There's any number of things. But how we play and how we work, sometimes we can have some injuries related to that. Safety. Please always err on the side of safety for yourself. Again, we talked about sunscreen, applying sunscreen. If we ride a bicycle or a motorcycle, always wear a helmet. Fasten our seat belts. Use and maintain smoke detectors at home and change the batteries when needed. Try to prevent falls. This is one of the biggest things in older people, and they have a fall at home, or they don't have their homes set up in such a way that's safe for them not to have a fall, or they have cords here or rugs that they can slip on and fall. And then if they get fractures, sometimes, especially in older years, it can be a real problem. Wash your hands often. I rarely walk by one of those little things where I don't do my hands. It just seems like I'm not getting paranoid, but the world's a dirty place, and that's one of the easiest things that we can do to protect ourselves is just keep our hands clean. Become trained in CPR. This is something that's very easy to do. Anyone can do it, and I just encourage people to get some kind of training in CPR so that if you're ever in a position where a loved one is down in the living room of your house, you at least know enough that you could give them some assistance. You might be the one that saves their life. So just a little bit of CPR training is very beneficial. I encourage everyone to do that. No cell phones while driving, especially if I'm on my bicycle and you're on your cell phone driving. We all know and we hear about this all the time, and it's one of the things that we're just trying to retrain ourselves not to be doing so many things while we're trying to driving. It's just all about safety here. Back pain and injuries. One of the most common reasons for absence from work is back pain related to car accidents, trips or falls, or improper lifting technique. This is a big one. When lifting, you want to lift with the leg and buttock muscles, not the back muscles, and especially as we go through life and get a little older, it's easy just to bend over and pick something up instead of bend at the knees and lift like this. It's just quicker, and sometimes all of a sudden we feel something in our back, and once we injure our back, sometimes it can become chronic. So correct lifting, lift with the leg and buttock muscles. Bend your knees when lifting heavy objects. Keep the object close to your body, no more than 8 inches from your body. Limit twisting. If you lift something heavy and twist, It's not good for the lower back. Many of you may already know that. Limit back fatigue. Tired muscles are prone to injury. If you do have a problem with the back, try to, when appropriate and when you can, rest your back a little bit, take a little bit of a break, and use both hands and lift slowly and deliberately. It's just one of the things that just by taking a moment and really thinking about what we're doing, we can really prevent injury and possibly prevent long-term chronic back problem. I'm looking at the time and we're getting close, but I'm just about done. Health literacy. Health literacy, the ability to understand, make decisions on basic health information and services. This is where you want to speak up and ask questions if you're in talking to your doctor. Challenge issues that you don't understand. Know your basic health history, family history, and meds. Use caution when extracting info from the web, from the internet. There's credible sites and there's sites that aren't credible if you're looking up medical information on the web. And just like a good one is Medline Plus or American Heart Association or American Cancer Society. Something that's credible, because there's a lot of information out there that's not all credible. Medications. Relative to health literacy, it's best to use one pharmacy. Carry a medication card in your billfold or your purse that has your health history and what medications that you're taking. Fill prescriptions. Take the pills according to the directions. Keep the pills in the original bottles. Do not take other people's pills. Throw away expired medications. Use a pill box if you have a certain number of medications. Carry your medications on the plane with you. Keep your pills and your pet's pills separate. That's a good one. Keep the name on the label showing the correct drug and dose. So lots of things relative to medications that particularly older people start to struggle with a little bit. Just very quick about heart-to-heart screenings, and I gave you all a brochure on heart-to-heart screenings. It's something we do here at Mercy Medical Center. It takes about an hour. It costs $35. They do a blood draw. They give you a lot of information relative to your blood draw. They do a health history. It plugs into a certain software. A nurse sits down and talks about the findings, tells you where you are, what things you might be able to do to improve, and where you want to be relative to your health. You even get a 15-minute neck and shoulder massage with it. But we do them both for men and for women here at the hospital. No physician order required. And if the husband and wife do it, the first is $35 and the second one is $25, so it's even less expensive. But heart-to-heart screenings. Live active, live healthy. This is what Lynn was talking about earlier, and it's going to be the subject, I think, next month. I'm a facilitator for the class. It's a great class, and I really enjoy being a facilitator. We have patients with all types of chronic diseases, from diabetes to fibromyalgia to arthritis to MS, whatever. And I've seen so many people helped by this class. It's 6 weeks, 2.5 hours per week. It costs $20. You get a textbook this thick. That's probably a $30 textbook by itself, and a relaxation CD as well that you get to keep. So it's really a neat class. And for anyone, or if you know anyone that deals with chronic illness, and again, Kathy will be here next month as well. I'd just like to thank you for coming, and I would just like to say this is all about preventing problems. It's all about having a family doctor and getting the screenings, or wherever you're at in life, getting those screenings, whether it's yearly or every 5 years, determine with your physician what's required, and just preventing disease so we don't have to fix things. So with that, I'll just thank you all for coming, and is there any questions about anything? Like I say, we could talk for an hour on any one of these topics, so we just kind of went through them quickly. So thank you very much for coming.